So electrolytes, all minerals, salts whose ions dissolve in water are electrolytes. Okay, like sodium, potassium, calcium. And why do we call them electrolytes? If you see the image shown here, all the minerals, uh, using their short forms, they are shown with the charge that they carry. Okay, you see a positively charged electrolytes like potassium, calcium, magnesium, sodium, and negatively charged electrolyte like chloride. Okay, so every mineral salt is an element that carries a electric charge. Okay, so electrolytes will definitely affect the way how your body functions because it moves inside and outside the cell. Based on the permeability of the cell wall, the electrolytes can move inside, move through inside and outside the cell. It can also get deposited on certain tissues of your body as well. Okay, so these are what we call as mineral salts or electrolytes. Okay, they carry electric charge, and they regulate the amount of water that you have in your body because water is the main component that is uh, taking these electrolytes inside and taking it outside. Okay, through the interstitial, extrastitial fluids and all, electrolytes can move within and outside the cells. Okay, major electrolytes are sodium, potassium, and chloride. These are the three major electrolytes we will be discussing in this particular chapter. Okay, main emphasis we will be placing on these three electrolytes: sodium, potassium, and chloride. Okay, so Milli equivalence formula. It's a chemistry based formula. No need to by heart. I won't be asking questions regarding this. Okay, just understand what is the uh, Milli equivalence formula. If you remember your basic chemistry, okay, if you remember the basic chemistry, even like those who are from the commerce background, if you try to recall, if we go to the atomic structure, okay, is the atom structure very similar to our solar system? I know the people from science background and medical background will definitely know the answer. Okay, but also trying to revising what you must have studied in your initial school days. The structure of the atom and the solar system. Everyone knows like what's a solar system, right? So we have sun in our center, planets revolve around the sun. Okay, so when it comes to chemistry, okay, what is in the center? You have positively charged protons, neutrally charged neutrons, negatively charged electrons. What comes in the center of an atom? Protons and neutrons are in the center. Okay, they hold the weight of the atom, atomic weight. What is atomic weight? The combined weight of how many protons this mineral has and the neutrons this mineral has. Where do you find the electrons, negatively charged electrons? Not just the outer orbit. Okay, every element has certain number of orbits. Okay, every element has certain number of orbits and electrons are spread around these orbits. Okay, so I guess you can understand, you can do a comparison. Okay, if you want to understand atom, just remember how our solar system is. Okay, sun being the neutron and the proton, combination of neutron and proton is the sun. The planets revolving around the sun is your negatively charged electrons. Okay, so the outermost orbit, okay, the outermost shell of an atom has certain number of electron, and that electron, that is the valence, the number of electrons a mineral has on its outermost circle. Okay, there are innermost circles also with different number of electrons. We are not considering that. Okay, the last orbit that an atom has and the number of electrons which are present on that last orbit makes up for the balance. Okay, so you see the Milli equivalent formula here. Okay, you like mg and eq means Milli equivalent equals to mg into balance, that is mmg stands for the weight, okay, atomic weight in mg, and atomic formula into valence, mg into valence. Valence is the number of electrons one has in the outermost cell, okay, divided by the molecular weight or the atomic weight. So that is add up protons, number of protons and number of neutrons. What is atomic weight of an atom? The number of protons and the neutrons it has. That is the center. The center has the entire weight of the atom. That is the protons and the neutrons. What comes in the numerators? Mg into valence. Valence is the outer number of electrons in the outermost area. So mg is milligrams here. Okay. So this is the milli equivalent formula. So just to make you understand what is the importance of electrons, protons and neutrons, how it comes into in the series of minerals, and what is the only formula which we consider here for electrolytes, because electrolytes are given in concentration. Okay, electrolytes are given in concentration, especially in medical practices. You do not have to give a concentrated electrolyte to any patient until and unless you are a practicing physician. Okay, until and unless you come into that particular role, you're not supposed to prescribe or give any specific concentration of electrolytes to any patient. Okay, that's the job only for the trained doctors. Okay, so this is a milli equivalent formula. You can either use milli equivalent or mg for that is milligram. Okay, you can convert it into milli equivalent and milligram. Just do the cross multiplication. Okay, I guess we all know what cross multiplication is. If you want to just cross that side of the equal to sign, okay, whatever, you just have to go opposite direction of the formula that you're using. Okay, so that is how we find these two concepts, milli equivalents and milligrams. How many milligrams we have to give, or in terms of milli equivalents you want to give an electrolyte, use this formula. Okay, no need to by heart it, just to make you understand what is valence, what is a molecular weight, also called as atomic weight. Okay, molecular weight and atomic weight are the same thing. Valence is a number of electrons in the outermost shell. Molecular weight or atomic weight is the number of protons as well as neutrons combined an atom has. Okay. So next, coming to sodium. Sodium is a major regulator of fluid balance in the body. So can anyone say, if you consume too much of sodium, what happens to the water in your body? If you consume too much of sodium, sodium does not always comes from your salt. Okay, there are various other sources of sodium as well. What happens to your body? Water retention. Your body is able to hold up a lot of water. Sodium helps the body to hold on to maximum amount of water. Okay, sodium won't make you dehydrated. Okay, because it causes water retention. It keeps the water inside the body. It does not allow excess water to move out of the body through sweat or urination. Okay, so sodium causes water retention. So people who suffer from hypertension and all, okay, BP patients, there for them we try to regulate their sodium intake, because we want to promote excessive urine in them, excessive urination in them, excessive sweat in them, so that the blood volume, okay, the blood volume reduces. Okay, because if the blood volume increases because of too much of water in the body, on top of that they are blood patients, the blood vessels cannot handle it. Okay, some people may go into stroke also, blood vessels may burst also, because of the amount of additional volume of the blood because of too much of water, as well as blood pressure which is emitted by the by this excessive voluminous blood onto the blood vessels, walls of the blood vessels. Okay, so that's the reason why sodium is not consumed for, is not advised for patients who have cardiovascular issues. Okay, so sodium is a major regulator of fluid balance and volume. It is essential for nerve transmission and muscle function. Adequate sodium will replace your losses in sweat. Like if you are dehydrated, okay, if you are dehydrated, if you have a bit of water with a pinch of salt and a bit of sugar in it, or glucose, better go for glucose, because as you drink, okay, immediately the glucose will be absorbed by the stomach linings also. It does not have to go to the intestine and get absorbed. So it's better to use glucose with a pinch of salt. Okay, so that sodium will help you to retain as much as water so that the body does not lose any more further water after a step down from dehydration. Okay, it helps you to absorb and retain fluid and also distribute the fluid evenly throughout the body. Okay, so that's the function of sodium in human body. So next, coming to the absorption and excretion of sodium. Every day we require around 3000 to 6000 mg of sodium, which is easily given to us by our diet. Okay, the amount of salt you have in your diet, the fruits and vegetables, fresh fruits and vegetables that you have in your diet, okay, that can give you this sodium, this amount of sodium on a daily basis. Okay, and the absorption is done by the stomach and small intestine. Okay, it is easily absorbed and it is carried by the blood. It is filtered by the kidneys and hormones and aldosterone and renin. Okay, which organ secretes renin? Anyone can anyone guess? Renin is a hormone secreted by which organ? Yes, kidneys secrete this hormone called renin. Aldosterone. Where do you find the adrenal gland? Because there are people from commerce background here. Where do you find the adrenal gland? Renin is secreted by your kidneys. Aldosterone is secreted by your adrenal gland. Okay. If you use terminologies like suprarenal, okay, suprarenal means it is sitting on top of the kidney. Okay, but those who are here from non-medical background, they will not be able to understand the medical terminologies. Okay, so try to use simple terms like the layman's language in the chat box for everyone to grab the concept. Since we are from medical background, it's easy for us to understand what is supra, is infra, etc. Okay, supra means on top. Okay, just on top of the kidneys, on both the kidneys, you will find adrenal glands. Okay, so adrenal glands secrete the aldosterone. Okay, they secrete other hormones as well, but since we are discussing about sodium here, okay, so hormone secreted by adrenal gland is aldosterone, and renin is secreted by the kidney. Okay, sodium is also filtered by the kidney in the sense, as soon as the blood reaches kidney for filtration, okay, with the help of hormones like renin and all, the kidney knows, okay, should we discard this excessive amount of sodium, or is the body running low on sodium? Should we filter it out and send back the sodium back into our system? Okay, the kidneys knows, the kidney can understand this particular um, methodology here. How much sodium should be discarded and how much should be reabsorbed back into the system. Okay, so when there is when there is too low amount of sodium, okay, when the body is maybe dehydrated, or you are on a salt restrictive diet for a pretty long time, you're not even a cardiovascular patient and you go on a salt restrictive diet, okay, what happens is naturally the sodium concentration in your body decreases. The kidney will release this hormone called renin. Renin will go and help the secretion of aldosterone from the adrenal gland. Okay, renin will help the secretion of aldosterone from the adrenal gland. What the aldosterone will do here, it will enable the kidney, it will command the kidney, do not filter out excessive sodium, take it back up. Okay, do the reabsorption of excessive sodium back into the body because the body is running low on sodium. That's how the mechanism functions here. Okay, that's how we also have hormones, these two hormones, aldosterone and renin, to make sure the body is not deficient in sodium. Okay, so based on these commands given by these two hormones, the kidney knows how much of sodium to be discarded off and how much it has to absorb back into the body. Okay, and when the body discards, like when there is too much of sodium, how will the body get rid of that? First is your urine. Okay, kidneys, through the kidney filtration through urine, you will lose a lot of sodium. Next is via your sweat. Okay, so these are the two, and even some amount of sodium is also lost in feces. Okay, the stool that you pass. So this is about the absorption, excretion, and excretion of sodium. Is it clear to all how the hormones function here? And sodium absorption is a very easy absorption, just like your glucose. Okay, it does not require fat. Okay, it does not require specific carrier cells or something like that. Active absorption takes place. Active transport takes place. As soon as the sodium ions touches the villi of your intestinal lining or villi of your stomach lining, okay, directly it can just go inside the cells. Enterocyte. Enterocyte is the cell of your small intestine. Okay. Is it clear to all? Absorption and excretion of sodium. Okay. So metabolism, where does it undergo this breakdown? It's in the jejunum and ileum. Where do you find jejunum and ileum anatomically? Jejunum and ileum. It's parts of your small intestine. Okay. So mainly by active transport. Active transport means as soon as the sodium ions come in contact with your cells, okay, intestinal cells, it is absorbed as it is into the intestinal cells, and from there it will be released back into the bloodstream. Okay. So in the jejunum, it will be taken up by the active transport, and it is also absorbed in the ileum part of your colon. Okay. When the body is running low on sodium, okay, when the body is running low on sodium, that's when the food reaches the colon. Okay, and the colon also gets the message that absorb as much of sodium as possible, the body is running low on sodium. So the first point of absorption is your stomach and small intestine, and jejunum part, specifically the jejunum part of small intestine, through active transport it will be absorbed. Okay. Second, in the ileum, okay, when the food reaches the ileum and the body is still running low on sodium, at that point of time also, from the ileum also the sodium will get absorbed. Okay. The nutrition, always remember the maximum amount of nutrition, okay, your vitamins, minerals, okay, all these things will be absorbed in your small intestine. Okay, maximum part of it will be absorbed from the small intestine. What is the use of large intestine then? What is the major role of large intestine in terms of absorption? What is large intestine supposed to absorb mainly from food? Yes, mainly it is water as well as these salts, what we are discussing. Okay. If the body is well hydrated and like if the body has a good electrolyte balance, much of the salts will not be absorbed by the colon. Okay, but from the large intestine, but usually it will try to absorb as much as water as possible from the food. Okay, so that's the major role of your large intestine. Small intestine will do the absorption of all your nutrition. Okay. So how can you do the regulation? It is just by your dietary habits, and make sure your kidneys are in good health. Okay, if you have somebody who suffers from some kidney issues or kidney problems, then according to what the nephrologist has directed, the amount of sodium, like if at all you have anyone, if you know anyone, friends or family, or you yourself may have undergone kidney transplant, okay, uh, can anyone just recall, or if anyone has this experience, what does the doctor suggest here about salt consumption? Is there a strict command over exactly you have to how much you have to measure of the salt and then use to all the three meals, or you can just use a teaspoon of it? It is salt restricted, and you have to definitely measure. Okay, so usually when if you come across any kidney transplant patient, okay, post or pre kidney transplant patient, and or any proteinuria patient, also in general. So when the nephrologist have given them the amount of salt what they have to consume, it is already mentioned how much mg of salt they have to consume per day. Okay, usually what they do, if they do not have a kitchen weight also we can't be that sure of the digital kitchen weight what we have. Okay, the digital kitchen weight what we have at home and all, we can't be that sure of it in terms of some milligrams. Okay, it could show some errors also. So to avoid that, what is the next best step possible? Think practically. Okay, think practically. If anyone has a family member who had this issue, you can't use your digital kitchen weight because it may show some errors. What's the next best option? Where would you go to measure out how much salt you should have or you should give this patient? Remember that amount. No, it's neither teaspoon or not pinch, because see, when you're taking a teaspoon or pinch, okay, if you ask a 30-year-old man, okay, to take a pinch of salt, and you ask a very petite young lady, okay, a petite teenager to take a pinch of salt, okay, will there be a difference in both these pinches of salt? There will be. See, the size of the hands also matters, right? So the best option here, always remember from our experience we are telling, always advise the patient family, whoever is going to cook the meal for the patient, the kidney patient, to go to a jewelry shop. To go to a jewelry shop, because the weighing machine the jewelry shop has now, that will show exactly the amount of mg. Okay, even the milligrams, in decimals, it will show exactly how much amount of salt can be used. Okay, you have to click the pick of that, or you have to take it into a container and measure out how much it looks like in a container, and use that measurement on a daily basis. Is it something that you can do? Is it easy to do, or is it a difficult procedure? And you can be very exact with it. Okay, so if at all you come across any kidney patient, even if they have a digital weighing system at their home, kitchen weight is there at their home, it's recommended, ask them to go to a jewelry shop, okay, any nearby jewelry shop, and the amount of mg, what the milligram, what the physician has, the nephrologist has recommended, okay, weigh it out in the jewelry shop weighing machine. Okay, you will get exactly that amount of salt. Okay, when you are using 1 gram sachets of salt and all, I don't think so it is easily available everywhere. Okay, when you think about people who are in the rural parts of India or suburban Indias, okay, if you want 1 mg salt packets and all, it's not easily accessible. It's always better to include how much ever it is possible to include all the family member from one source of food. That is what you have to aim for. Okay, 5 members in a family, and every 5 of them requires a specific sources of food. It will be very difficult to keep up. Okay, even for patients who are under dialysis, there is definite salt restriction, definite salt as well as fruit restriction. Okay, so you have to think about, you have to do this out of the box things, thinking that how exact they can be, because exactness is very ideal when it comes to sodium consumption in kidney patients. Okay, first of all, you will be given a list of salt, the list of food that has low sodium content. Okay, every sources of food has certain amount of sodium. Okay, we can't control that. So you will be given a list of food that is already on the low sodium side. When we will discuss about the chapter on diet in cardiovascular diseases, okay, we have a table on that. We'll discuss that table in detail. Okay, about sodium, the diets, the fruits, vegetables, and pulses and cereals that are naturally low in sodium. Okay, we have a table on that. So you will be given that list. On top of that, how much salt you have to add, that you have to be very exact of. Okay, you can't mismatch, or you can't just do some 90-20 formulation for that. Okay. So distribution of sodium in your body, half of your sodium intake, how much of sodium you have already took within yourself through diet, half of it you will find in your extracellular fluid. Okay, 10% of it will be in your intracellular fluid, and then rest is found in your skeletal system like bones and muscles. Okay, extracellular fluid is the fluid that um, is present around your cells. Okay, around your cells. Intra, definitely it is inside your cells. Okay, which of this extracellular fluid, okay, fluid that is around the cells, intracellular fluid, it is the fluid that is present within the cell. Okay, which of this causes edema? Which of this causes edema? Edema means swelling. Excess of extracellular fluid or intracellular fluid? Extracellular fluid, when the fluid accumulates around the cells. Okay, too much of water, too much of fluid around the cells leads to swelling. Okay, too much of water inside the cells means the cells will just die off. Okay. Next, hyponatremia. Hypo, reduced. Natremia, it's the amount of sodium in your blood. Okay, the last word of this medical terminology is EMIA. Okay, that is related to the concentration of this particular mineral. Okay, mineral salt in the blood. Okay, specifically it is about your blood. It's not about your any other body organ. It's about your blood. Decreased hyponatremia, natremia, reduced amount of sodium in your blood. So that's the definition of this medical terminology. So what are the symptoms here? There will be convulsions, okay, seizures, convulsions, fatigue. They may feel very weak. Okay, in some cases, extreme cases, they may go into a state of coma. They can lose their consciousness. Low blood pressure, feeling nauseous and vomiting. Okay, that's the body's sign of telling that if you vomit off, obviously you are going to replace the lost fluid through drinking something or eating something. Okay, so that's the body's way of gaining back some sodium. Okay, so these are the signs and symptoms of a person who may be who may be low on sodium. But usually it's seen in this, all these symptoms are also seen in people who are extremely dehydrated. Okay, and if at all you come across any cardiovascular patients or renal patients who are showing these signs and symptoms, chances are that they are running very low on their sodium. Okay. Sources, the best source is your table salt. Okay, all the salty foods that you have, animal foods, milk, baking soda, eggs, cereals, carrot, tomato, legumes, all your fruits and vegetables, they come with certain amount of sodium concentration. Daily recommended allowance, this is for just an adult. Okay, if you want specific RDA, you have that big ICMR table in the textbook. Okay, also it's better to refer the latest ICMR table from online. That is much better, because what we have in textbook is much older version. There have been certain tweaks done to the ICMR table recently, so please refer what is given on online for your practical purposes. Okay, 1 to 5 gram of sodium is all right for adults. Okay, and 1 gram of sodium chloride per day for people who have a history of hypertension. For nutritional requirements and diet for people who are suffering from colon cancer, we have a separate chapter on that. Okay, if you're asking like specific to a particular disease, all the diseases are covered in the dietetics subject. Okay, there is diet for cancer patients, diet for patients in gastrointestinal issues. So in both these chapters, we'll discuss in detail about what kind of diet could be given here, especially when we come to the chapter on diet in gastrointestinal issues. We'll discuss this in detail. Okay, not just colon cancer, but other forms of IBS and other colon related disorders also. What kind of diet has to be given is mentioned. Okay. So effects of too much of sodium. Okay, definitely high blood pressure, because too much of sodium means too much of water in the body. And where will most of the water go? It will get mixed with it. It will just go into the bloodstream. Okay, too much of water means too much of runny blood, and already the patient will be having certain BP. Okay, when the blood volume also increases along with the cardiac output, blood pressure will jump high. Okay, heart failure, left ventricular hypertrophy. Hypertrophy means increase in size. Increase in size of the left ventricles. You have two atrium, two ventricles, right and left atrium, right and left ventricle. Okay, left ventricle comes to the left side of your heart. Okay, on the near to the left part of your rib cage. Okay, please check the YouTube recorded sessions for gastrointestinal issues. Please check that video. It could help you out. The person who is suffering from colon cancer. So that is left ventricular hypertrophy, increase in size on the left ventricular side of your heart. Stroke, if at all the blood vessels burst, but that will never happen on just like within a day or two. Okay, stroke always happens to people who have been suffering from hypertension from a pretty long time. Okay, a person who had a history of hypertension for the past 10 years or more, okay, they have higher chances of getting stroke. Okay, you are suffering from blood pressure from the past 1 year or 2 year, okay, then you may get stroke. That is very rare. Okay, that never happens usually. The patients who are suffering from hypertension from pretty long time, maybe because of heart diseases or smoking or any such other uh, lifestyle diseases, okay, they have high chance of getting stroke. Okay, gastric cancer, edema, kidney problems, and kidney stones. There is a specific kidney stone in which sodium causes the stone. Sodium mineral will deposit over a period of time on the tissues of kidney or ureters, okay, and then it can lead to stone. Next, coming to potassium. So potassium will help your cells to uptake nutrients and water. Okay, same like sodium, it will help your cells to get not just water but all other parts of minerals as well, to and fro the cells, inside the cells and outside the cells. It helps your muscles to contract, even your heart muscles. Okay, potassium will also help your heart muscles to contract. Can anyone give what is the do we use potassium based electrolytes as emergency medication? Anyone from the medical background? Do we use potassium based electrolytes as emergency medication, and for in which condition? Under what scenarios do we give the shot of potassium chloride? Emergency, in emergency situation. Yes, to regulate the BP. Okay, to regulate the BP, we do get not just for low BP. Okay, even to regulate the BP and also to correct the electrolyte balance. Why? Because see, when and also with during cardiac arrhythmias. Okay, when the heartbeat is not properly, heart is not beating properly, we do give potassium chloride or other electrolytes that has potassium, because any electrolyte which is kept in the emergency department, or with any electrolyte which is kept in the code blue trolley, okay, these all are high alert medications. Okay, these all electrolytes come under high alert medication. Okay, they can kick start the heart and put it into a beating state. Okay, because it helps in muscle contraction. It will make sure the heart contractions and relaxations are on point. Okay, even to correct cardiac arrhythmias, potassium based medications, not just potassium chloride, potassium based medications are given. Okay, even in cases of cardiac arrest is given. So that makes potassium a high alert medication. Okay, any electrolyte which has a potassium as a combination, kept it on which is kept on the code blue trolleys, people who work in hospitals, they would know. Okay, it comes under high alert medications. Okay, it helps your nervous system to carry messages between and to and for the brain and body, balances your body's fluid and regulates the blood pressure. Okay, that's how when the cardiac muscles contract properly, relaxes properly, automatically your blood pressure will also slow down. Okay, it helps your body to digest food. Okay, it aids in the absorption of other minerals and nutrients as well. And potassium and sodium has an exchange system. Okay, the intestine has to give out certain ions of sodium, so that certain ions of potassium, so that sodium can enter. Absorption and excretion of potassium, it is readily absorbed by passive diffusion into the gastrointestinal tract. Passive diffusion is this exchange. Okay, like when sodium is given out, potassium enters. When potassium is given out, sodium enters. Okay, the amount of potassium in the body depends on the balance between potassium intake and output. Okay, it is completely based on your diet. Potassium output, that is potassium excretion, occurs through your gastrointestinal tract, that is through your feces. Okay, your motion that you pass, your skin, through the sweat, and through urine. So potassium deficiency, weakness, fatigue, most of the symptoms are very common in sodium as well as potassium deficiencies. Okay, blood pressure that will come down, breathing difficulty, heart palpitations, mood swings, muscle cramps because the potassium helps in the contraction and relaxation. So when the muscles are not having enough potassium to do its work, it can lead to certain cramps. Okay, tingling and numbness, because potassium, remember, it helps in sending the signals to and fro the brain. Okay, and the body, it connects the brain and the body with signals. So if at all there is a certain tingling and numbing sensations you have, or sometimes you may have anesthesia here and there. Okay, that could also be an indicator that your potassium levels are coming down. Heart palpitations, that is, you can feel your heart beat on your chest. Okay, it feels like your heart is beating just on your chest. Usually when a person's heart beats, like when our heart is beating right now, we don't feel it. Okay, but when you're stressed, okay, when you're nearing your fear, or you're in a very fearful situation, you can actually sense your heart beating. So that is heart palpitation. So RDA is on table 10.2 for potassium, recommended allowance for adults, infants, and children. For men and women, for children and infants, it is the same. Gender barrier is not there. For adult, men and women, for different sodium, potassium, both, what is the ratio should be maintained is also mentioned on the table. No need to by heart the table. It's just for your reference. Whenever you sit with the client, you may, if they have any questions, some clients may have these questions that how much mg of potassium should I take, how much mg of sodium should I take. Sometimes you may not remember these values. Okay, so at that point of time, these tables can help you out. Then toxicity, cardiac arrest, it can lead to cardiac arrest and renal failure. And renal failure and any form of toxicity is a vicious cycle. Okay, either toxicity can lead to renal failure, or renal failure can lead to toxicity of certain minerals. Okay, because if you are suffering from renal failure, kidney failure, okay, definitely the filtration quality is not good. The GFR, glomerular filtration rate, is not good in your body. So you may be suffering from some or the other toxicity, and for to overcompensate that, you have to control your diet. Sources of potassium on table 10.3, your all the pulses, legumes, millets, what we use in our Indian daily cuisines, like bajra, ragi, or whole wheat, the urad dal, that is black gram dal, moong dal, soya bean, banana. Banana is a really good, I guess we all know banana is a really good source of potassium. Dates, raisins, imli, that is your tamarind. Okay, so these all are good sources of potassium. Next, coming to chloride. Chloride, it has it has a negative charge. Okay, it is present in your body as chloride ion, and it's a major anion. Okay, anions are the ones that has negative charge. Cations are the ones that have positive charge. Okay, sodium and potassium are cations. Chlorine is anion because it has a negative charge. In the extracellular fluid, main function, it is to regulate your water balance, and it regulates the osmotic pressure, and it makes sure that certain fluids in your body stay acidic. Okay, as a part, for example, can you give an example? I guess we all know what's the very common acid we have in our body, and why is it acidic? Because it has chlorine in it. Hydrochloric acid. Okay, so chlorine makes sure that in whichever fluid it is mixed up, it keeps that fluid acidic. Okay. It also helps in nerve impulse conduction, very similar to potassium. Okay, it makes sure that the nerve impulses is able to pass from the synapses. Synapse is the area where one nerve ending connects to the other nerve ending. Okay, so chlorine, we require chlorine there to make sure that the nerve impulses carry on. Okay, they keep on going from one nerve to another, one nerve cell to another. Then hydrochloric acid formation in the stomach. Okay, for that also we required chlorine. These are the main functions of chlorine, and it is also used in carrying our oxygen from the lungs to the body tissue. They help in carrying oxygen because they help hemoglobin to carry oxygen from the lungs to the body tissues, and also carbon dioxide from the body to the lungs. In the presence of chlorine, this gas exchange takes place without any issues. Okay. Absorption and excretion, rapidly and almost is completely absorbed from your GI tract. Rarely you will lose chlorine in your feces. Okay. Under normal condition, excretion will take place through your gastrointestinal tract. That is, some part of it will be lost in feces, as if whatever you eat, okay, whatever you eat in your diet, it is not 100% absorbed by your intestine. Some part of it is definitely lost in digestion. So that part of chlorine will be lost in digestion, your skin, by your sweat, and through urine. So chloride is excreted mostly as sodium chloride, and chiefly it is through your kidney. About 2% is eliminated through feces. Very less amount of chlorine will be eliminated by feces. Okay, that too, which was never absorbed by the body. Okay. Plasma chloride, that is your blood chloride level, should be around 95 to 105 milliequivalent per liter. So this is how to read this formula. Okay, milliequivalent. You should know the first formula that I have shown. Okay, mg into valence divided by the atomic weight. That is the formula for milliequivalent. So deficiency of sodium is very rare. Okay, very rare, until and unless you are dehydrated. Okay, completely malnourished, and children who suffer from SAM and all, you can see some chlorine deficiencies there. But that's the reason why, as soon as the kids who suffer from marasmus, okay, or not in case of kwashiorkor, but in case of marasmus, when a child suffers from marasmus, the first thing what we do is we initiate the IV fluid, okay, because we are trying to bring back the sodium as well as chlorine back to normal, okay. Sources is your table salt. Any doubts, please mention in the chat box.